Hello everyone, thank you so much for tuning in. Good evening. This is going to be the second to last part of the exam that's going to be basically our final in microbiology. So we have recently discovered diseases to go over in this set of notes. The teacher gave us these notes on Thursday, last Thursday. So this Thursday is our final, so just a little bit more. All right, let's get started with Legionnaire's disease. This is aptly named because there's the original outbreak in the Legionnaires attending an American Legion convention at the Bellevue Stratford Hotel in Philadelphia in 1976. 182 were infected and 29 died at that event. The cause of the disease is the bacteria Legionella pneumophila. It's a gram-negative rod, and it's also aerobic. Just highlight that. The transmission, it's again going to be in the same order as the other slides. We have the information on these very few slides that we actually need to know for the test. So I'm going to just go over that. So the transmission is vehicle by H2O or aerosols. So droplets. It's found in lakes, air conditioners, and even the misters at the grocery store. There was a person who was in the microbiology class, and according to one of the teachers, they got Legionnaires from the vegetable mister at the grocery store. As well as spas. Get this from spas too. They could survive in amoebas, which is very strange. Signs and symptoms. We have the incubation from 2 to 10 days. There's a high fever of about 40.5 degrees Celsius. We also have a dry cough and chills. Advanced stages will have diarrhea and nausea. Epidemiology, there are 8,000 to about 10,000 cases a year in the U.S. And prevention, we could chlorinate water, as well as the water and cooling towers, and in shower heads. Distinctive features in the healthy, you're going to just see pneumonia. In the elderly, we are going to have this horrible 15% mortality. There are some recent outbreaks in 2018 in Quincy, Illinois. There's the new Illinois Veterans Home. After 13 residents died since 2015 of the disease. In St. Louis, a Marriott St. Louis West Hotel, 2 guests had contracted the disease, and the water tested positive, so they had to clean that place out for a few hours. In April 2021, during COVID in Macon Comfort Inn in Missouri, there was a Legionnaire's outbreak in the hot tub. Next, we're going to be talking about gastritis. Then we're going to switch the color here. Gastritis has been seen 60,000 years ago from this bacteria called Helicobacter pylori, migrating out of Africa with humans. The gastritis is thought to be caused by spicy foods. However, in 1982, Barry Marshall and Robert Warren discovered H. pylori. He drank a culture of pylori in the 1980s to show that you can get stomach ulcers from this bacteria, and by drinking the culture that had the bacteria in it, he won a Nobel Prize in Medicine in 2005. So there's that. We are like all chuckling about that in class, and he brought it up. It's like, okay, drink the culture of bacteria and they get a Nobel Prize. But anyways, so the pathogenesis of this bacteria, it's going to survive in the acid of the stomach. It uses something called urease. And this is going to cause urea from the proteins into ammonia. This is going to, of course, increase the pH and create like this microenvironment of alkaline status. So it's going to make this little basic area around itself. That's how it's able to survive. And they also have these flagella that are going to burrow in the mucus layer. And they're kind of guided by the pH gradient. They're going to go from the stomach lining. So the pH, again, it's going to guide them from the stomach lining into the epithelial. Okay, so again, the causative organism is Helicobacter pylori. They're curved gram-negative rods. Like that, they're gram-negative. And they have these polar flagella. That's why it's pH sensitive. I don't know why I'm thinking about HP printers. I meant pH sensitive. Sorry about that. The transmission is going to be the fecal oral route. Again, wash your hands. Flies may transmit from feces. Incidence increases with age and higher incidence in low-income groups. I should put elderly. There we go. The virulence factor, we kind of talked about it already. They survive in the acid by producing urease. That's going to take urea to NH3. That's going to increase the pH. And then we're also going to have those polar flagella that burrow into the mucosa. The symptoms include peptic ulcers, that cause abdominal pain and bleeding. And we're also going to get to stomach cancer, unfortunately. However, most of the cases, 90% of these cases, are going to be asymptomatic, which is extremely scary. Treatment, we're going to be adding the antibiotic combination, and then we're going to also inhibit the stomach acid. Let me see what I wrote during class. How does inhibiting the stomach acid? Oh, I guess I didn't write that. That's the same thing I wrote up there. All right. Okay, next disease is going to be the toxic shock syndrome. And this is given by James Todd, a Denver pediatrician, in 1978. Procter & Gamble, they released this Rely tampon, and it was supposed to be super absorbent because of the carboxymethyl cellulose and polyester. And it would blossom into a cup when it's inside a person to prevent leakage. Let me get back up here because this is all up here too. So in the 80s, 890 cases of TSS are reported. 812 or 91% were associated with menstruation, and 38 or 5% of the 772 women with menstrual TSS died. And so they recalled the Rely tampon in 1980 September. So in the span of 1 month, we had these horrible deaths of all these women. Okay, so now this is going to be medically known as the staphylococcal toxic shock syndrome. There's going to be, of course, the involvement of Staph aureus, and of course that's a gram-positive cocci. Common mode of transmission, we're going to be introducing this into the wound or vagina. Again, the tampons were blocking because of that cup formation, and that allowed for the bacteria to grow there. Unfortunately, then the virulence factors included the TSS1 toxin, and this is the super antigen. The symptoms include multi-system organ failure, and there's going to be a sunburn rash. Of course, there's also going to be shock, hence the name. Prevention. We're going to avoid high absorbency tampons and change them frequently. They're going to be classified as Type 2 medical devices in 1980. Now we could talk about the emerging diseases. So now when we're talking about emerging diseases, the first one that we're going to be looking at is severe acute respiratory syndrome. Also known as SARS. This was an outbreak back in February of 2003 in China. It's going to be caused by the SARS-associated coronavirus. And it's going to spread to 4 other countries. The case fatality rate is 10%, which is pretty high. And we spread it through the air routes. MERS is going to be known as the Middle Eastern Respiratory Syndrome. It's by another coronavirus called MERS-CoV, and MERS first appeared in the U.S. May 2nd, 2014. Again, this is going to be MERS-CoV. Let me just get updated here. This is going to come from a disease in a traveler from Saudi Arabia just so happened to have the virus with them. And so this all started in the U.S. in May 2nd, 2014. And then we go into South Korea in 2015. This is where we have the large spike. In July 5th, we have 186 cases and 36 die. It's a 37% case fatality. The causative organism is, of course, the MERS-CoV. This is a single-stranded RNA virus. Transmission, it's going to be respiratory, which is kind of in the name there, specifically secretion, close contact. And then we have something called the infectivity index. For MERS, we have an infectivity index of 2. This means for every one person, they could infect 2 other new hosts. Okay, the incubation, 5 to 6 days. Virulence, again that 34 to 37. Case fatality. And prevention, it's basically all the stuff you would do against COVID: hand washing, covering the mouth, and disinfection. Okay, now we are going to look at the COVID-19. So now this is specifically COVID-19, which we've gone through, and it's still around. There's still variants as of making this video. Just need to make sure you keep updated on the vaccines and still practice, again, hand washing, covering your mouth, disinfecting, fomites or inanimate objects and surfaces, and then also vaccines. It's going to be like the flu, it looks like, where it just comes back every time with a new variant. We just get a new vaccine, that's that. Right, COVID-19. Of course, it's going to be a SARS CoV-2 agent. It's ssRNA. The transmission is the same as MERS, so I'm just going to add the new stuff here. There's going to be asymptomatic patients spreading it. The infectivity is going to vary. So alpha strain this is like the first strain, alpha strain, when we talk about that. That's the first strain that we saw. This is 2.2 to 3.2. And then we got to Delta, the Delta variant. Remember that one, of all the airways and stuff. That was horrible. We have greater than 5 infectivity, and then Omicron. I didn't know the Greek letter for that, so I'm just going to write the word. That was 6.3. Large increase in the infectivity index. With Omicron, one sick person could get 6 1/3 people sick with COVID-19. It could spread the virus to that many people, potentially. Signs and symptoms. So asymptomatic or dry cough. Shortness of breath. And then some people have long COVID as well as paralysis. I remember Tom Hanks and his wife, they got the alpha strain, I think, when they were in Australia in 2020, and they couldn't walk. It was very hard. You also lose your sense of taste and sometimes sense of smell as well. Incubation period is 2 to 14 days. Case fatality rate is 2%. Prevention is the same, but the only difference here, we have vaccines. Again, it looks like it's going to be just like the flu, where each year there's a new variant due to all the artificial selection, that all the lack of proofreading when the virus hacks the host cellular machinery. So we're just going to have to be prepared, All right, now we could talk about the spillover infection. It's going to be, I think, our last category, if I remember from class. Single event when a pathogen changes into, or I should say changes hosts to another species. Okay, so it could either result in the outbreak, or it could just not be transmitted. We have a few examples here. We have Zika. Zika is the mosquito-borne virus identified in humans in 1952 in Uganda and the United Republic of Tanzania. In July 2015, there's a case in Brazil. And we're going to have this startling association between Zika and Guillain-Barré syndrome. October 2015, there was a connection or an association between the Zika virus and microcephaly in the infants. So I'm going to just write this down. 1952. And then Brazil, October 2015. This is when Brazil, we saw it be connected with microcephaly. The causative organism is going to be the mosquito virus, flavivirus. That's the genus, so it's like Zika virus from the flavivirus genus, I guess. This is an ssRNA. Transmission. This is going to be the Aedes mosquito bite. Mom to child. Or through sex. Virulence factors include attachment, fusion, and invasion. The incubation is 3 to 12 days. Symptoms. Again, we're only going to the unique ones here. We have fever, rash, joint pain, muscle pain, headache. We have birth defects, unfortunately, with this, such as the microcephaly seen in the Brazilian outbreak. The treatment listed is only to treat symptoms, which is extremely worrying. Prevention, we have to avoid mosquito bites, of course. You could use repellent. Or nets, again, that's mosquito control. Or we could also avoid sex with infected people. There's a lot of active Zika transmission in the areas such as South America and Central America, especially the Caribbean. The probability of occurrence of Aedes aegypti, we have a large occurrence of it in South America, the middle of Africa, India, some parts of China, top of Australia, as well as Florida and the Midwest and some of those East Coast Appalachian areas in the U.S. Right, now we're going to talk about Nipah. NIPAH. This is the NIV, also known as that. Let me highlight it. So in 1988, it was first identified in Malaysia in the pig farmers. The pigs were the intermediate hosts. Then the 1999 outbreak caused the mild disease in pigs, and then there are also 300 human cases. 100 plus deaths out of those 300 cases. Humans. In 2004, Bangladesh humans were infected with NIV because of the date palm sap contaminated by the fruit bats. This is going to be the flying fox. That's one of the main perpetrators here. They contaminate the palm sap that hasn't been treated or cured. And human-to-human transmission has been documented. So this not only could go pig or bat to pig to human, this could also be human to human. As seen in India, the causative organism is, again, the NIV. This is a Henipavirus from the genus. That's its genus, and it's, again, an ssRNA. Transmission, it's going to be in the wild animals. So it's basically bat, pig to human, and also going to get the raw date palm sap. Do not drink that. That's another way of getting it. The incubation is 5 to 14 days. You're going to have a headache as well as neurological conditions and confusion. Treatment, this is also unfortunate. It's just supportive care. Prevention, we don't have a vaccine, unfortunately. We are not able to vaccinate against this, unfortunately, so we could only avoid the potential causes or the transmissions. We have to avoid all of those. Hopefully we do get a vaccine soon, but as of these notes, we do not have a vaccine for it, unfortunately. Right now, we're going to talk about Ebola. Ebola has a ton of symptoms, and these include headache, red eyes, systemic fever, lack of appetite, internal bleeding, muscular aches, joint aches, intestines and diarrhea, rash and bleeding in the skin, stomach pain and vomiting, chest pain, hiccups, sore throat, difficulty using your esophagus and your trachea. In 2012, there are 86 cases, of which 51 die. Ebola outbreaks happened in 2014 and 2016. These are going to be in the 11,000 death range. They're going to be in some of these countries, such as Liberia, Guinea, Sierra Leone, Nigeria, and Mali. And then the outbreak in 2018 and 2019 was unfortunately even larger. In this one, we had 2,196 deaths out of 3,298 cases. And this is going to have a 66% fatality rate. They have the most strict PPE on when you're dealing with Ebola, and it's just extremely fatal. 66% chance with all those symptoms. In the US, we had 3 cases and 1 death in 2014. Spain, we also had 1 case, 0 deaths. And then, fortunately, in Africa, they're still suffering with all of these emerging diseases, and we need to make sure if we're, part of the World Health Organization, and we need to make sure that resources and medicine are more accessible to everyone. So the Ebola and Marburg hemorrhagic fever, they're going to be caused by the Ebola virus or the Marburg virus. These are filoviruses, meaning thread. If you see a picture of Ebola, it kind of looks like that. They're ssRNA viruses. The transmission is going to be bodily fluids. That includes semen and bat contact. Incubation period is 8 to 12 days. Virulence factors are going to be the disruption of clotting factors. Symptoms include fever, fatigue, headache, minor petechiae, and that's going to go into internal bleeding, and then death. Again, 66% fatality rate, case fatality rate. And I think that's the last slide. Let me just make sure up here we didn't miss anything. The clinics were overwhelmed by just the virulence of this Ebola. And I think I have everything else there. Many symptoms. Those are blood blisters, these petechiae. I'm sorry, I'm probably butchering this. This is a blood blister. Right, I think that's all of them there. Yep, that's the last slide. All right, thank you so much for tuning in. Again, please continue to make good choices, do something nice or so on, and I wish you all the best. Have a good evening.